Hi, folks. Thanks so much for joining us today. My name is Dr. Taslim Alani-Verjee, and I am the founder and director of SILM Center for Mental Health. And today we're going to be talking about de-escalation training. So this is really what to do when there is a mental health emergency. So I thought we'd first start by talking about why. Why do we need to be having this conversation? What's going on for us to need to have this conversation? And I mean, there's a lot going on right now. When we think about what's been going on in the world around us, when we think about what we've been perhaps hearing in the news, we know that when it comes to police interactions and when it comes to people struggling with their mental health, police just aren't the most equipped body to be handling these situations. And yet at the same time, they're usually the only ones that we know to call. And so what I'm hoping that we can accomplish together today is to figure out what can we as individuals do to prevent having to call the police in the first place? And then if we do have to call the police, what other things can we do? So when we think about police interactions with individuals with mental illness, there was a CBC study done in, I believe, 2018 that demonstrated that 70% of people who are killed by the police have been struggling with mental health. So whether that's that they have a history of mental illness, they're in a mental health crisis, they are using or abusing substances, regardless of what it is, what we end up seeing is that um, people are being killed by the police. We also know that Black, Indigenous, and people of color are more likely to be killed by the police. Now, we can speculate all sorts of reasons for why that might happen, but the reality of the situation is that it is happening. We also know that there is systemic racism. Now, um, when we think about these things, we often think about examples in the United States, and we can maybe be a little bit more confident that um, there is racism amongst police officers in the United States, but we don't have those statistics here in Canada. And one of the reasons we don't is because we actually don't collect them. And so what you have is external bodies kind of gathering information. But I wanted to share a few examples just to really um, make it clear that this is a problem here in Canada. So, for example, in Winnipeg, Indigenous people make up about 10 to 11% of the population, but more than 60% of the people who have died through police encounters have been Indigenous. In Toronto, Black people account for 37% of individuals who are killed by police, but they make up slightly more than 8% of the population. Um, a Globe and Mail report from 2019 showed that between 2007 and 2017, so over the span of 10 years, more than 1/3 of people shot to death by the RCMP were Indigenous, and Indigenous people make up less than 5% of the population. And the Ontario Human Rights Commission demonstrated that Black Torontonians are 20 times more likely to be shot by police than the city's white residents. And so, again, this isn't just an American problem, and this isn't just these stories that we hear once in a while, but they're not indicative of a larger pattern. This is definitely a larger pattern. And so, if we want to do something about it, let's learn, let's figure it out together. This is also not about villainizing police. Police are just people like the rest of us. And yes, they have training, and yes, they have responsibilities, but their inability to address these problems adequately are not the fault of an individual police officer, but more a systemic problem around what a police officer's job and training entails. Police officers are often not trained on how to de-escalate situations. They're often not taught about what it's like to deal with someone who's experiencing a mental health crisis. And so if they're not trained how to deal with it, or they don't have enough training on how to deal with it, then how can we expect them to have the skills in order to do that? We also need to remember that they're human too. And again, this isn't an excuse for poor behavior, for violent behavior, and for discriminatory behavior. But if we really want to address the problem, then we need to recognize what contributes to it. And we know that there is stigma around mental illness. We know that there is systemic racism that exists within our institutions. And then we're all socialized to have discriminatory attitudes and beliefs as well. And so we're police officers are human just like the rest of us. And if we try to expect different things from them without putting in place the right tools and strategies to make that difference, we're really just going to be shouting for no reason because we're not going to see that change happen. So what do we mean by de-escalation? What exactly are we talking about? So people escalate when things are not going well. If we think about how the brain works, really, when a situation is not going well, when a person is experiencing fear or anger, anxiety, their brain's ability to think through things rationally ends up being compromised. And when it gets compromised to the point where they're no longer able to think rationally, what actually happens is they completely lose that ability. And so their prefrontal cortex, which is this part of the brain over here, it gets compromised, and people are more likely to act impulsively, irrationally, emotionally. And so we end up seeing poor decision making. Now, this can happen to any of us, regardless of whether we experience a mental illness. And so it's important to recognize that it's happening to someone when they're getting escalated. It's probably also happening to police officers when they're engaging in these situations. It would probably also happen to us if we were trying to de-escalate someone who is experiencing a mental health crisis. So none of us are immune to this. And so that's that escalation process. It's the building up of something. Now, we can think about this in situations where people are not seeing justice, or they feel like their rights are being violated. And so for any of us, I mean, we've probably been a little over escalated at any point in time in our lives if we feel like there is an injustice being done, if we're watching something that doesn't feel okay, if someone is, or feeling threatened. And so we might act or react maybe in disproportionate ways to the situation, but usually because we're feeling some sort of threat or we're watching something that seems inexcusable happen. This can also happen when a person's understanding of reality is being affected by their mental health. And so when we think about what's going on in this part of the brain over here, right, it might be that the situation is making us react that way, but it might also be what's going on in our mind and how we're perceiving the situation is making us react in that way. So regardless of whether it's the situation itself or our perception of the situation, something is going on to make us react in big ways that prevent us from understanding the reality of the situation, or staying calm and thinking through rationally what would be the most helpful next step. It's important to understand that people with mental illness are not generally violent. And I think that this is one of the ways that a lot of people end up turning to violence in order to protect themselves or to protect other people when it comes to someone who's experiencing a mental health emergency or crisis, is that there's an assumption that the person experiencing the mental health crisis is actually going to behave in a violent way. And so we'll feel threatened by that. But research actually tells us that individuals with mental health problems are more likely to be victims of violence than to perpetrate violence. And so when we can remember that, even when someone is behaving erratically or unpredictably, it doesn't mean they're going to be violent. It just means that that behavior is unfamiliar to us. And so we might be having a feared reaction to that. But the likelihood of a person being violent is actually quite low. So when we can keep that in our mind, that might help settle some of our own fears. So now, what can we do? The number one thing that we can do is actually prevent mental health crises from happening in the first place. And there are a lot of different ways that we can try to do this. And so I'm going to walk us through a few of them. And then I will also walk us through what to do when we're actually dealing with someone who is experiencing a mental health crisis. Now, why prevention? Prevention because, of course, if there weren't as many mental health crises in the first place, then perhaps we wouldn't need to ever call the police or ever consider calling the police. And people would just feel better. They would have better quality of lives. The likelihood of mental health crises would just decrease. And so some of the ways that our society can do this, number one, is through defunding of police, which there's been a lot of talk about, and reinvesting in communities. If there were more investment in communities, we'd see less trauma happening. We'd see more of a sense of community, more support programming in place. We'd see more proactive programming rather than reactive programming. And so when we invest in communities rather than in crime intervention or punishment, then we can see some of those effects already in place. We can also think about getting mental health supports in place before things become crises. And if we're able to encourage our loved ones to seek out mental health supports, whether that's through counseling, even talking to their family doctor about getting some of those supports in place, perhaps referrals to psychiatrists, whatever it is, if we can encourage the people that we care about to seek out the support earlier on, we're also less likely to see mental health crises happen. This is especially in a problem in communities where there's more stigma, and usually in Black, Indigenous, and people of color communities, we see that there is a lot more stigma around mental illness, and so there is less of a likelihood for people to engage in therapy. And we also know that the health systems are often more discriminatory to those folks, and so it's not just that people are fearful for no reason or are judgmental for no reason. They have reason to not trust health professionals. And so as we encourage our loved ones to engage in the process, we want to make sure that we understand some of their hesitations and some of their fears so that we can really meet them where they're at. But the more proactive we can be with getting the supports in place for ourselves and for our loved ones, the less likely we are to see mental health emergencies. If we notice that a person is getting escalated, it's also best to have family and friends or supports around so that they can notice when a person is getting escalated. And so if we have someone in our lives that does struggle with their mental health and does have a likelihood of getting escalated, knowing what kinds of triggers are likely to escalate that person is a really good place to start. Knowing what some of the signs are of when that person is getting escalated. That way things can be de-escalated beforehand. And usually as friends and family, we also know some of those de-escalation strategies that are specific to that person. So, if you notice that a person is getting angry or worked up and we're around, maybe offering to go for a walk with the person as opposed to having them continue to get angry or worked up. Or if the person is talking about things that we can't see or we can't hear, but we know that they're experiencing them, offering to engage with them in that conversation as opposed to shutting it down. Things like that can be really, really helpful. And then we also have in Canada, here in Ontario, mental health crisis responders. And so this might be through calling a crisis center. There are several phone numbers that we can call, but these individuals, the people who answer those phones, the people who respond to mental health crises, in terms of those crisis responders, are also more equipped to handle those situations than police would be. So we can kind of see that there's the prevention part in terms of what we can do to prevent the mental health crises from happening, and then also what we can do as individuals to help de-escalate a person before they get so escalated that it becomes a crisis. And then there are some things that we can do, like calling the crisis lines when a person does get to the point where they need extra help. So while prevention is a great first step, people are going to continue to have mental health crises. It's just the way it works. And mental illness can often be unpredictable. Now, when a person is appropriately adhering to treatment, whether it's counseling, whether it's medication, we're less likely to see these mental health crises. But when they happen, and we need to know what to do. And ideally, what that means is not calling the police, simply because we know that the moment we bring the police in, the likelihood of that person being injured or killed is significantly higher. Now, there are certain situations in which we will have to call the police. For example, if the person is about to seriously injure themselves, some of us have professional obligations to call police. And so we have to use our clinical judgment, but we also have to use the laws that we're governed by. But when we're talking about just a person and another person and two people trying to work something out, there are certain things that we can do. But we want to make sure that we can appropriately manage the situation. And if it's a situation that we can't appropriately manage, or we are likely to get injured in the process, then it might be worth calling the police. And so I wanted to put that caveat out there, because I'm not suggesting that we never, ever bring police into the situation, because police can save lives and often have saved lives. We just want to be really thoughtful about how we do that. So one of the first things is to really focus on ourselves. And the reason why this is the first thing is because how we present ourselves will make a significant difference in how an individual interacts with us. So we want to try to stay calm. We also want to check our own fears and our own anxieties. And so it might be, checking in on some of the stigma we have around mental illness, some of the stereotypes that we believe about the individual that we're dealing with, and kind of just checking ourselves and asking ourselves whether our attitudes in that moment are warranted given the situation, because how we're feeling in the moment is definitely going to affect how we end up reacting. We also want to ask ourselves if we feel like we have something to prove. I remember one of the first times a client was having a mental health crisis in my office, and I was working at a place where there were other mental health professionals, and there was definitely part of me that felt like if I didn't manage the situation correctly, that others would watch that happen, and that would have something to do with what they thought about me. It's really important to remember that when someone is going through a mental health crisis, it's not about us. It's not about us even a little bit. And if we feel like we have something to prove, it's going to affect our ability to really be there for that person and to de-escalate the situation. And so if you feel like others are going to judge you for how you deal with the situation, really try to manage those expectations and manage those judgments and manage that pressure, because it's going to get in the way of you being able to deal with it effectively. Try to make it about the person and their needs, not about you and your needs. Of course, your own safety is important, but other than that, in that moment, your ego is not more important than the person going through a mental health crisis. And so we just want to really be aware of that. So some of the things that we can do is to physically appear calm. And so we want to appear confident and assertive, but not aggressive. We can use a soft tone of voice, and we want to be respectful to the individual, and we want to manage defensiveness. So if the person is accusing us of anything, in that moment when we can tell someone is actually going through a mental health crisis, it's not helpful to be defensive. Because by the time someone is so escalated, remember, they can't think rationally, because that part of the brain that usually does think rationally has been compromised. Now, again, whether that's a mental health crisis or someone that's just really, really mad, trying to be defensive, defending why we did what we did when someone is so angry is not going to get us anywhere. And so trying to manage our own defensiveness will really be helpful in those moments. Our body language is extremely important. So we want to make sure that we're not turning our back on the person, and instead to try to stand at an angle so that the person doesn't feel trapped, but they still know that you're focused on them and that you're still very present and engaged and taking them seriously. We don't want to stand directly in front of the person, because that might come off as intimidating or aggressive. We also don't want to corner the person, because obviously when someone is cornered, they're going to feel trapped, and that's likely going to escalate or worsen the situation. We also don't want to corner ourselves, because if the situation does escalate and we need to get somewhere, being cornered is not going to work out in our favor. We want to try to maintain eye contact, but not too much eye contact. And the reason why is because we want the person to know that we're paying attention and that we're engaged, that we're actively listening. But when we stare, or we don't let our eye contact veer from the person's eyes, that too can come off as aggressive. And when we communicate aggression to a person who's already escalated, that can further escalate them. And so what we want to do is make sure that they know that we're there and we're listening to them without them having to feel like we're being aggressive. We also want to try to be at the same eye level as them. So if the person is sitting down, try to sit down as well. Or if the person is on the ground, try to get down on the ground. And this is because if we're standing while the person is sitting, this can often make us feel like, or make them feel like we are overpowering them, or controlling them simply by the eye level stance. Similarly, if we are down and they are up, it doesn't put us on equal playing field. And we want to really, in de-escalation, make sure that both parties are feeling, or not feeling, but are being perceived as equal in those situations. This will allow the person to kind of be met where they are at without overpowering and without us overpowering them. We want to try to take extra space between the two people. So, for example, if I were having an argument with any of you, or any of you were in need of de-escalation, I would think about what is a normal, comfortable amount of space between the two of us, and then I would take a little bit more. And the reason why we want to take a little bit more is because we, again, don't want the person to feel trapped. We want them to feel like they can move around if they need to. But we don't want to be so far away that the person doesn't feel like we're actually connected and engaged. And so one of those things is kind of just feeling it out. It's also harder when it's someone that we don't know or don't know as well, because we don't know what that comfortable space might be between the two of us. But even just using your own judgment around that. You don't need a measuring stick or anything like that. Just thinking through and trying to keep some space between the two of you. You want to try to consider your facial expressions and make sure that they communicate empathy, and they don't make light of the situation. So frowning, probably not helpful. Smiling, also probably not helpful. When we stand, we don't want to stand with our arms crossed or even on our hips, because that can usually communicate defensiveness or aggression or a power stance that's unhelpful. We also don't want to keep our hands in our pockets. We want to keep them visible just so that the person is not worried or distracted by anything that we might be hiding, so that they can really focus on the communication and the interaction between the two of us. And of course, no one likes to be pointed at, so none of this, because that usually just makes people feel even more threatened. Nobody likes to be pointed at, so trying to avoid any finger pointing. When we're thinking about our verbal communication, we want to try to speak calmly and with an even tone. Try not to yell, and keep our voice volume at an average level. So not shouting, but also not whispering, because we're just having a conversation, and the person ought to be treated with respect. And usually respect is communicated through how we speak with an individual, as well as our body language, which we already spoke about. Try not to interrupt the person, because it's not about what you have to say, it's about what they have to say and about what they need, which is also about active listening. And when we're actively listening, it's again not really about what we have to say. And of course, when we interrupt anybody, nobody likes to be interrupted, and so this can further escalate the situation if we do interrupt them. We also want to not try to argue or convince the person of anything, because again, it's not really about that in that moment. If someone is so escalated, or they're in crisis, arguing or convincing is probably not going to work, because again, the part of the brain that can usually understand and rationalize things is already compromised. And so that process of trying to convince probably won't work. We can try to offer options or choices as opposed to telling the person what to do. And this can empower the person, allow them to feel like they still do have some control over the situation, and can offer them alternative options. Sometimes when a person is so much in crisis, their mind gets stuck in only one option. And so, whether that option is to harm themselves or to harm someone else, or whatever that option is, it might feel like it's the only option they have. And again, because the part of the brain that usually can see those other perspectives and options is compromised, they might be stuck in that single option. And so being able to offer the person alternatives might allow them to see that some of those alternatives might work out, and that might make them a little less stuck in the one option that they saw, without taking away their control of the situation. We want to explain rules firmly and respectfully, not with threats. And this is usually the case if we're working in an institution. So if you're at a hospital, um, or a community center where there are rules and the person can't be doing what they're doing. Explaining what the expectations are in terms of behavior can often be helpful, just to let them know that what they're doing is inappropriate, but we don't want to do so with threats or with accusations or with shaming, because again, that's not helpful. We want to try to empathize with the person's feelings. And so if we notice that the person is expressing anger, empathizing with that. If they're expressing sadness, empathizing with that. But we don't want to empathize with the behavior, because the behavior, as we're seeing it, is likely inappropriate for the setting, or maybe just always inappropriate. And so while we can empathize with how the person is feeling, we don't want to make them feel like what they're doing in reaction to that emotion is appropriate. And we can also try to suggest alternative behaviors if they appear open to this. And so again, this kind of goes back to the choices, but even being able to shift the person a little bit in their stance, like being able to sit down and have the conversation as opposed to standing, or being able to put an object down but still have the conversation, or going for a walk and continuing to have the conversation. Anything that can create a little bit of change can allow for that stuckness to decrease just a little bit, and that might be enough to help de-escalate the problem. And then we also want to consider what exactly is distressing the person. So do they feel threatened by what's going on, or who's present? And is there anything that we can do to decrease this? And so it might be that the person is actually having a conflict with someone else, or there's some sort of problem with someone else. Can we intervene in that to help the person feel less threatened in the situation? If they have a weapon, we also want to think about what they're doing with it and what they likely intend to do with it. Sometimes when we think about a weapon or see a weapon, we automatically assume that the person intends to use it, but they might actually just be feeling threatened, and that might be the thing that's helping them feel safe. Of course, we don't want to be in a situation where we might be harmed or the person might harm themselves, but thinking about this weapon and whether it can actually cause serious injury, how they're holding it, what they're doing with it, all of that can help us make decisions about how we want to then take a next step. Are there other people that we can bring in without overwhelming the person? And so, if there's a family member or a friend that's also around, perhaps we can call them in, and that person might also be able to reassure the person and offer a different perspective. Again, when we can remember that it's not about us and our ego, we don't need to be the hero in this situation, and so we can work on it as a team, as long as it doesn't overwhelm the person. And so being able to read their body language, being able to understand what they're communicating to us, all of that can help us decide whether it would be appropriate to bring in another person, and the role that that person can play. Are they willing to be distracted? Every once in a while, a person is in distress and they just don't know how to regulate their own emotions. And so if they are willing to be distracted, that's something that we can definitely do. Some of the strategies that I've used in the past are, if the person is open to it, of course, being able to sing a song with them, and just singing together, or going for a walk, or tossing a ball. It really depends on the person and how they're presenting. Some people are absolutely not willing to engage in that process and be distracted, but other people are just really looking for a way to calm down and feel okay, and they just don't know how to do it. And so if we can offer some of those strategies, then maybe it will work. And so, think about what you have around you, what skills you have, and being able to use those in a way that might be able to help the person feel like they have a little bit more control over their emotions, and to make them a little bit less stuck in what they're going through. We also want to respect what they're going through. And one of the tricky things that we often see people do is, for example, if an individual is experiencing hallucinations, so if they're seeing things that other people can't see, or hearing things that other people can't hear, we don't want to make them feel like there's anything wrong with them, or that they're crazy. So instead, being able to respect what they're going through, even if we're not going through the same thing or we can't experience the same thing. Acknowledge that they're going through it. You don't need to say that you see it too or you hear it too, but rather recognizing that it's very real for them, that experience is very real for them, as opposed to saying, well, it's not there, or I don't see what you see, because that can make a person feel threatened. It can make them feel like there's something wrong with them, and that might further escalate the situation as well. So those are some of the strategies. I know that there were a lot out there. Hopefully some of them will stick if you ever find yourself in a situation where you do need to de-escalate. These strategies can be used even in everyday life if we are experiencing confrontation with someone, but especially when someone is going through a mental health crisis. Now, if we do have to call the police, whether because we don't know how to deal with the situation, we're feeling overwhelmed, it's our professional obligation, these things do happen. Some of the things that we can try to do is to be an ally for that person. So we can try to stay with the person, and our presence in that interaction may actually be the difference between, make the difference of survival for that person. When there is a bystander watching the police, they are held a little bit more accountable. And so sticking around as opposed to calling the police and leaving can make the difference between someone's life and death. We can also try to contact people that the person knows. So these are support people. And of course, this would be most likely the case if we were dealing with a stranger. So if we see a stranger having a mental health crisis and we don't want to call the police, if we can find out who that person knows, who are their support people, we can call those people to try to be a part of the intervention, even if we have called the police already. If you do know the person, try to advocate and explain. So once police show up, try to explain what's going on, try to explain what usually works for the person, try to explain how frequently this happens and how people usually deal with it. And if we can ascertain before the police show up what the person is willing to do, that can make a really big difference too. So for example, if we know the person is agreeable to going to the hospital, and so we had maybe called 911 just to get them to the hospital, and things escalated through the police showing up, then we can also try to communicate to the police if the person is agreeable, encouraging the waiting for paramedics so the person can go in the ambulance, things like that. So if we can know what the person is willing to do ahead of time, we can be that person's representative or their advocate to help kind of be the go-between for the individual and the police. So these are some of the things that we can try to do. So with that, I'm going to open it up for some questions. The way that I have set up the Zoom webinar is that if you do submit a question, it will come straight to me so no one else will see what you're asking, just in case that helps decrease some of the shyness or anxiety in asking a question. So I'll just give it a minute or so in case anyone does have any questions. And I'll just open the chat box here. Okay, so I see a couple of questions here. So one is when we're interacting with people virtually, whether in a professional capacity or in a social capacity, if someone is going through a mental health crisis, what are some of the things that we can do? And so, you know, when it comes to how we're communicating and our body language, these things can be communicated virtually as well. So kind of like watching, I mean, with a computer, it's a little bit harder when we think about eye contact, but I mean, there's definitely a difference between me staring right into the webcam the entire time or me diverting my gaze every once in a while. And so, you know, trying to make sure that we're still paying attention to the eye contact. We're not looking distracted. We're speaking in a calm, even tone of voice with average volume. We're really hearing the person and what they need. We're maybe even slowing down the rate at which we're speaking in case the person is open to matching that, which usually is a bit of a less conscious process. And so we can still do many of these things, but it's also really helpful to be equipped with some services for crisis support. And so if the person is open to having, for example, a call to a crisis line, that might be something, or a mobile response team, which we have, that can be a possibility as well. And so if we can stay with the person, even virtually, as a third party comes in and intervenes, that can be helpful. Just a few weeks ago, a client of mine was experiencing a mental health crisis. And so what I did was I actually stayed on the phone with her and called the police and tried to explain to them what was happening. One of the things I learned, in case anyone tries to do that, is that if you try to three-way call 911, the person you were speaking with originally gets disconnected, and 911 is the call that ends up taking over. And so if you do decide to stay on the phone with a person, use a different phone and call 911. Don't use your three-way calling feature, because it won't work, or at least it didn't on my phone. But being able to kind of explain what's going on beforehand, so that when, whether it's 911, whether it's a mobile crisis team, whoever it is, whether it's a family member, that person knows ahead of time what's going on, so that the person in crisis doesn't need to re-explain things, doesn't need to worry about being misperceived, and hopefully can get the kind of support that they need. It's always really good to have a person's address on hand. And if you're working with them clinically, you ought to have that anyway. But that can help make sure that the person has some safety. But again, when working clinically, or when talking to someone, even a family member or a friend, really paying attention to our voice, how we're listening, how we're responding, and our body language. So again, like, not sitting back like this as if it's no big deal, but also not necessarily up here, where a person might not have the space that they need, even though the actual physical space isn't changing. That can be really helpful. And if the person is willing to be distracted, willing to engage in deep breathing, or some grounding strategies. So some grounding strategies can include things like noticing 5 things that we can see, 4 things that we can hear, 3 things that we can smell, 2 things that we can taste, 1 thing that we can feel on our skin, or being able to count from, 10 to 1 backwards, being able to even like say the alphabet, being able to just plant our feet on the ground, being able to deep breathe. These are all grounding techniques, and they can all also help with de-escalation. It kind of just depends on where a person is at in terms of their crisis. Then there's also a question of, or a request to share crisis resources and support numbers. So if you go to the silmentalhealth.com website, you'll see all sorts of resources there for specific communities, as well as for the GTA area. So I would just refer folks to our website. That's not me kind of plugging in an ad. It's just all nicely there already under community resources. And so there is the Toronto Distress Center's line, where you can send a text message or make a phone call. The Gerstein Center has a phone number. They also have a mobile response team, and I believe they also have some beds there. Their Kids Help Phone, Good to Talk for post-secondary students. And then, of course, there are mental health hospitals like CAMH, Ontario Shores. And so there are a few different options, but I would encourage you to check out the website where there are a list of resources. There's another question here. What can you say to the police if you're going to call the police to build some credibility with them so that they take you seriously? And so if we're calling on behalf of someone else, it doesn't matter what our professional hat is or our title is. I think generally people want to be equipped when they're going into an unknown situation. And so being able to even explain what's going on and what we think the person needs as a support person, as a professional, it doesn't really matter who we are. We probably have some information that the police don't have because the police haven't interacted with the individual yet. And so hopefully just being able to provide that information would give us some credibility. But the other thing that we can do is offer to stay on the phone with the individual and to continue to be there. And so we can, even if we're still on the phone with the person who's going in crisis, or if we're physically present, continuing to be present or stay there on speakerphone, or even on video, and kind of help with that communication, help kind of be that third party advocate for the individual going through a mental health crisis. Now, if we're calling for ourselves, which could also be a possibility, at that point, it kind of just depends on what our capacity is to communicate. And so if we're fearful for whatever reason, you know, it's a hard expectation to ask anyone to be able to communicate anything soundly when they're dealing with a crisis. And so, you know, a lot of folks do call the police, and that's the only number they know how to call. I am hopeful that in the next few years we'll see that there are other numbers that people can call that aren't the police that can respond to mental health crises. But as of right now, usually 911 is our go-to number. There's another question here of how can we stay calm when dealing with someone who's going through a mental health crisis? And I would encourage everyone to kind of use the same grounding strategies that we would encourage other people to do. So being able to engage in deep breathing, trying to notice any racing thoughts, or when our own mind is getting stuck somewhere, changing our stance every once in a while, checking in with our own body language. The interesting thing about body language is the moment we adopt an aggressive body language stance, we actually, our whole tone changes, right? And so if we're actually standing like this and having, sorry, I don't know if you can see my arms, but if your arms are crossed and you're having that conversation, you're actually changing the way your brain is processing what's happening. And so we might not notice it right away, but if we notice that our arms are crossed or that our hands are on our hips, actively removing the crossed arms or removing our hands from our hips, all of those things can actually help us de-escalate a little bit so that we can stay more calm and deal with the situation a little bit more proactively. I'm just going to wait a second more for some more questions, see if anything comes up. And while I do that, I'm also just going to share our contact information in case folks have any more questions. So if you do have any questions, you didn't get a chance to ask them here, that's not a problem. You're always welcome to reach out to us. So our email address is admin@silmentalhealth.com. And if you did want to check out our website, that's silmentalhealth.com, and that's where you can find some of our community resources. You can also be reached by phone, and you can also reach out to us through Instagram or Facebook. The other thing I wanted to say before people head out is that, you know, we at Silm Center for Mental Health are very much about advocating for community and supporting community. And so if you are involved with different community groups and you think that this kind of training would be helpful, we're always helpful to get involved, or always willing to get involved, and are hopeful that we can make a difference in the communities that we serve. So thank you so much for joining, everyone, and I hope you all have a wonderful evening, and we will see you again soon. Okay, take care.